I'd like to assure you that Guam Memorial Hospital is safe. That Guam Memorial Hospital is Joint Commission, and as such, we will provide the nationally recognized standard of care.
With that statement, Interim Hospital Administrator Ray Vega gave his report to the newly impaneled GMH Board of Trustees Thursday night, discussing cost containment efforts that the new management team has identified. Among them, a decision to significantly reduce and, in some instances, altogether cut on-call pay for non-physician staff. Last year alone, the hospital paid out $1 million for 138,000 hours of on-call time for various employees.
We have come up with an immediate resolution. We've asked some department to completely eliminate on-call. We just want to make sure that care or delivery of care and services are not compromised, and we should see some significant reduction on the on-call pay.
Associate Administrator for Medical Services, Dr. Larry Lazama, also discussed physician contracts, such as neurosurgical services, that have resulted in the hospital paying out $580,000 each year, but not necessarily for services the neurosurgeons actually perform on patients. As we reported, one neurosurgeon who is contracted to work at GMH for only 20 days out of each month is paid $400,000 a year and only performed a single surgery last year.
That needs, reevaluation and discussion, certainly among us, whether how to best deal with the high cost of providing the service and the current level of care and standard that we have set.
Management is also looking at improving services while capturing revenues. Closure of the outpatient component of the hemodialysis unit was also brought before the board for consideration, but members simply took the proposal under advisement. Meanwhile, it appears that the hospital's finances are on the road to recovery. GMH has improved collections by $1 million as compared to the month of February.
That is primarily due to us hounding the insurance companies to pay on the receivables, and so far they've been very accommodating, and they have come up with some cash in the month of March, and we hope that the same scenario would be repeated for the month of April.
Couple that with net losses going from more than $2 million in the month of January, $500,000 in February, and $376,000 last month alone. Management is cautiously optimistic that things will only get better. Reporting for Guam's News Network, I'm Mindy Egan.